Hello everyone, I am Liu Gang, a PhD candidate from the Knowledge Management and Innovation Research Center, the Hong Kong Polytech University. Today, I will present my study, entitled as An Emerging Knowledge Management Framework Adopted by Healthcare Workers to Combat COVID-19. This study was conducted together with Professor Eric Cui and Professor Anno Canto. To the best of my knowledge, this is the first study that comprehensively examined the role of knowledge management elements in combating a new pandemic. This seminar is divided into 4 parts. First, let me give you a brief introduction about this study. In history, epidemics are always a big threat to human beings. Millions of people died because of them, such as plagues, 1918 flu pandemic. COVID-19 was first detected in Wuhan, Hubei province, China in December 2019. Very quickly, Wuhan became the COVID-19 epicenter of China in January 2020. By 26 April, hospitalized cases in Wuhan dropped to 0, indicating that COVID-19 in China is under control. However, the confirmed cases around the world surged above 10 million, and over 500,000 people died of COVID-19 as of 30th June 2020, according to the World Health Organization. Today, COVID-19 is still spreading in many countries. People knew nothing about COVID-19 when it emerged, which makes medical treatment extremely challenging. The more knowledge about a new epidemic and the faster this knowledge is obtained, the fewer victims there are. As such, more knowledge about an epidemic can save more people's lives and prevent more people suffering from misery. Knowledge management can quickly equip knowledge workers with the needed knowledge, but it is difficult to find how knowledge management helps healthcare workers to deal with a new epidemic from literature. Previous studies mainly focused on summarizing lessons learned of the past epidemics, such as lessons learned from SARS. Therefore, application of knowledge management to deal with public hygiene crises is poorly understood. This study tries to investigate knowledge management elements involved in treatment of COVID-19 and contributes to public health crisis management by offering a feasible and effective knowledge management framework. Now, let's move to the second part of this presentation, research method. This study applied a qualitative research strategy and analyzed the data collected from the press conferences held by Chinese authorities. Content analysis is a popular method that is used to analyze text or other symbolic materials for social science purposes. Content analysis is appropriate for this study because this study analyzed the content of press conferences of China. The raw data came from press conferences of China. The first category is the press conference of Joint Prevention and Control Mechanism of the State Council, People's Republic of China, which has been held every day since 5th February 2020. At the press conference, the chairman introduced all the measures and policies that had been put in place to contain COVID-19 and to sustain people's lives and economic activities in China. The second category is the briefings of the State Council Information Office, People's Republic of China, which were held whenever necessary to share progress of COVID-19 containment and treatment. Following the chairman's introduction to the topic, journalists asked questions and speakers offered answers. More details about the press conferences can be found through the internet link shown in this slide. Of the 87 press conferences held between 22nd January 2020, the first state's briefing on COVID-19 containment, and the 31st March 2020, 23 were related to COVID-19 medical treatment, including 7 press conferences from SAIL. Next, we coded up and analyzed the content of the 23 press conferences to further explore the knowledge management elements of the COVID-19 treatment, including the introductory content from the chairman of the press conferences. Each pair of questions and answers were coded, but only the content of the introduction and answers were analyzed. The coding complied with the following rules. The first 4 digits of the code are the date and month of the press conferences. The next digit is the number of the press conferences on that date, followed by the item number of the content of the press conferences. The next code is an abbreviation of knowledge management elements, followed by the name of the speaker. We clustered these elements into different knowledge management element categories based on a framework identified in my PhD thesis. Now, let me give you an example to show how the content was coded. 0702 indicates 7th February 2020. 2 indicates the second press conference on 7th February. 10 indicates the 10th item in the content of the press conference. HRM and KFC indicate knowledge-based human resource management and knowledge-friendly culture were found from the answer of Yan Hongguo. Yan Hongguo is the name of the speaker. After introducing the research method, I want to show you the results and findings that are revealed from the press conferences. Based on a wealth of evidence extracted from the press conferences, this study found an emerging knowledge management framework in which a knowledge-friendly culture was well formulated among the healthcare workers. The officials from authorities and managers from hospitals in different levels demonstrated strong knowledge-based leadership. The objectives and principles of rescue were based on strategic knowledge management approaches. The knowledge codification strategy and knowledge personalization strategy were developed simultaneously. Knowledge-based human resource management and knowledge management-related information technologies were widely applied for knowledge processes. These knowledge management elements play a significant role in combating COVID-19. The first important finding is that a knowledge-friendly culture was popularized among the healthcare workers. This culture is characterized by intensive knowledge sharing, seamless collaboration, and rapid innovation. You can see there are many items related to knowledge sharing culture. To be specific, knowledge was shared between doctors from different hospitals or in the same hospital. For instance, Vice President of Liaoning University of Traditional Chinese Medicine, Guan Xuefeng, discussed treatment plans with Chief Physician Zhu Bo from Xiangyang First Hospital, as shown in the first picture. The second picture shows Chief Physician Yu Ting discussed treatment solutions with his colleagues in Jinyintan Hospital, Wuhan. In addition, many academicians, such as Li Lanjuan, as shown in the pictures, Zhong Nanshan, Zhang Boli, etc., participate in medical treatment and shared their knowledge with younger physicians. These intensive knowledge-sharing activities helped frontline healthcare workers improved their efficiency to save COVID-19 patients' lives. It was also revealed that healthcare workers collaborated well with each other to solve complex problems. As COVID-19 invades many organs of human, such as lung, heart, kidney, and liver, elderly people and those with chronic disease and comorbidities, such as hypertension and diabetes, are more likely to experience serious effects which are difficult to treat. Therefore, specialists from multidisciplines worked together and integrated their knowledge to find the best solution for the patients. Additionally, practitioners in Western medicine and traditional Chinese medicine collaborated to offer treatment plans for the patients with the aim of yielding better treatment performance than just one type of medicine. Evidence from this study showed that new ideas and solutions were implemented during treatment for COVID-19 patients. For instance, solutions like convalescent plasma therapy and stem cell treatment, drugs like chloroquine bisphosphatase, favipiravir, and some traditional Chinese medicine were used to treat COVID-19 patients when these innovative solutions and drugs proved to be effective. The second knowledge management element found in this study is knowledge-based leadership. Knowledge-based leadership is the capability of leaders to influence others on knowledge management processes and activities. Three aspects of knowledge-based leadership, namely participation of leaders in knowledge management encouragement, and research and development support were manifested in this study. Managers of hospitals positively participate in knowledge management. As Dr. Li Haitao, Vice President of Peking University First Hospital said, we set up a mechanism for sharing knowledge and experience between the colleagues from the different hospitals. Knowledge management is also encouraged. Knowledge sharing is not only limited to Chinese healthcare workers, but open to international medicine communities. Knowledge about COVID-19 treatment has been shared to more than 100 countries and 10 international organizations by 5th March 2020. Frontline doctors and researchers are encouraged to publish research papers so that more people can obtain new knowledge of COVID-19. As I mentioned earlier, many new solutions and drugs were used for COVID-19 treatment. Without strong research and development support from leaders, such achievement would be difficult to reach in a short time. The third knowledge management element reviewed in this study is the application of strategic knowledge management approach in COVID-19 containment and treatment. Strategic knowledge management relates to the processes and infrastructures that organizations apply to obtain, create, and share knowledge for developing strategies and make strategic decisions. Here are coded items regarding strategic knowledge management found from the data. This study found that Chinese government has highlighted the importance to put people's life and health first and try its best to protect and save its people's life by adopting a science-based approach. Based on knowledge of previous epidemics, National Health Commission China proposed a principle of early identification, early isolation, early diagnosis, and early treatment to contain COVID-19. And the principle of 4 concentrations, to concentrate patients, medical experts, resources, and treatment into special centers to guide the nation's COVID-19 containment and treatment. National Health Commission also proposed a clear objective for treatment, which was to enhance the recovery rate and decrease mortality. These objectives and principles work through China's COVID-19 containment and treatment. The fourth knowledge management element is the knowledge codification strategy. Knowledge codification strategy focuses on codifying explicit knowledge into documents so that people can easily obtain. The knowledge codification strategy firstly is reflected by frequent updates of national diagnosis and treatment protocol. Since trial version 1 of the protocol published on 16th January, 7 version protocols have been published in less than 2 months. Each update of the protocol included new knowledge of COVID-19. This collective knowledge codification extends and updates healthcare workers' understanding of COVID-19 and help them treat patients more effectively. As I mentioned in last section, Chinese doctors and researchers actively codify their knowledge into research papers. These research papers provide new knowledge of COVID-19 that can help human beings to fight against the new pandemic. Besides the protocol and research papers, many documents, such as nursing rules, traditional Chinese medicine guidelines, were also codified. The fifth knowledge management element involved in COVID-19 treatment is the knowledge personalization strategy, which is used for tacit knowledge sharing and application, etc. This study revealed that knowledge has been shared intensively in different forms, including face-to-face and remote expert visits, consultations, and guidance. These experts shared their knowledge with frontline doctors and offered solutions for severe patients. In addition, face-to-face and remote regular meetings of discussion about complex cases were well organized. From the discussions, healthcare workers can obtain knowledge on how to treat complicated cases efficiently. Such intensive tacit knowledge sharing enables healthcare workers to further understand COVID-19 treatment and improve their capability to save patients' lives. Finally, Chinese experts and doctors positively participate in international knowledge exchange activities to contribute Chinese wisdom to the world to combat COVID-19. The pictures showed an example of an academician, Zhong Nanshan, shared Chinese COVID-19 treatment experience with European doctors. The sixth element emerged in is knowledge-based human resource management, which mainly involves 3 aspects. First, a powerful expert team was assembled to combat COVID-19. The expert team, comprising academicians such as Zhong Nanshan, Li Lanjuan, Wang Chen, Tong Xiaolin, Huang Luqi, Zhang Boli, and Qiao Jie, etc., was organized at the beginning of the epidemic breakout. The expert team guided the nation's treatment for COVID-19 patients. These experts not only participate in treatment, but they also update the clinical protocols to guide all healthcare workers. Second, over 42,000 healthcare workers summoned nationwide to Wuhan and other cities in Hubei province from 24th January 2020 to 1st March 2020. Participation of these healthcare workers mitigated the pressure of medical rescue systems of Hubei province, especially in Wuhan. The more professional the healthcare workers involved were, the more patients could be saved, because the patients also needed healthcare workers' knowledge and help to fight against COVID-19. Third, mandatory training courses in terms of avoiding infection within hospitals and of the hospital information management systems being used for COVID-19 patients were conducted for the healthcare workers before they started their work to ensure they had deep understanding of COVID-19. With effective training and monitoring, the healthcare workers were equipped with the necessary knowledge to protect themselves, and all of them returned to their hometowns without infection. The last knowledge management element is knowledge management related information technologies, which are widely used in COVID-19 treatment. Knowledge repository and platforms for knowledge sharing and codification have been developed. As shown in the pictures, COVID-19 academic research communication platform and 2019 novel coronavirus resource were developed to store and share the latest COVID-19 knowledge. Video conference and 5G remote diagnosis and consultation systems were successfully applied in COVID-19 treatment. As shown in the pictures, doctors from different places can work together to find best solutions for severe patients with the help of video conferences and 5G remote diagnosis and consultation systems. Artificial intelligence, big data analytics, and machine learning are also involved in COVID-19 treatment. For example, the COVID-19 Intelligent Assistant Diagnosis System based on X-ray and computed tomography photos of the lung are available for medical workers on the website of China National Center for Bioinformation. Based on learning 500,000 clinical iconographical materials in advance, this system applied natural language processing and artificial intelligence to analyze photographs, yielding smart and faster diagnosis of COVID-19 cases with 95% accuracy. Facilitated by an emerging knowledge management framework with 7 knowledge management elements, namely knowledge-friendly culture, knowledge-based leadership, strategic knowledge management, the knowledge codification strategy, the knowledge personalization strategy, knowledge-based human resource management, and knowledge management related information technologies reviewed in this study. Healthcare workers of China were swiftly equipped necessary knowledge to combat COVID-19. More and more infected patients recovered as shown in the figure. After discussing findings, I want to give you some conclusive remarks about this research. This study reviews a framework including 7 knowledge management elements that can guide authorities and hospitals who face a similar situation. This study also deepens our understanding about the role of knowledge management elements in responding to an unexpected pandemic. Besides theoretical contributions, this study also offers some practical implications for healthcare workers and policymakers. Authorities should first develop containment and treatment strategies based on knowledge rather than on their political needs before developing a knowledge-friendly culture and knowledge-based leadership to guarantee the knowledge activities. Complementary knowledge codification and personalization strategies should be implemented, and a group of experts should be organized, and healthcare workers should be trained to quickly spread knowledge. Finally, knowledge management related information technologies should be implemented to facilitate disease treatment. This study has some limitations. First, this study focused on COVID-19 treatment based on data obtained from the press conferences held between 22nd January to 31st March 2020. Future studies might extend the dataset by interviewing doctors and nurses who participate in COVID-19 treatment, or by analyzing data about COVID-19 treatment from media and social media to obtain more knowledge. More knowledge management elements might be found to mature this emerging knowledge management framework into a complete one. Second, as Chinese medical experts actively share knowledge and collaborate with experts from many countries and organizations, future studies might explore the function of knowledge management elements in the global containment of COVID-19 based on global cooperation. Third, as many countries and international organizations are working together to contain the disease, it might be worth investigating the differences in knowledge management elements between different countries or examining the extent to which the national differences, such as the national culture and economy, may affect the identified knowledge management elements and/or additional elements in terms of responding to a public health crisis. These are the publications that have supported my research. Thank you for attending this research seminar. If you have any questions, please feel free to contact me or this email. I'm happy to answer your questions. Bye-bye.